I'm Taylor Tuck,
I'm Tara Haft.
And I'm Tanyasia Brewster.
and we're going to talk about the normal swallow. First is our explanation to a medical student.
The four phases of swallow include the oral preparatory, oral transit, pharyngeal, and esophageal phase. The oral preparatory phase begins when food or liquid enters the mouth. During this phase, the substance is chewed and mixed with saliva to form a bolus. This phase can be broken down into three important components: lip closure, tongue control, and mastication. The cranial nerves involved in this process are the facial nerves, trigeminal nerve, and hypoglossal nerve. The facial nerve controls the orbicularis oris muscle, which is the primary muscle responsible for closing the lips. The trigeminal nerve is responsible for sensory feedback from the maxillary and mandibular branches, which allows one to perceive their mouth and jaw position. The hypoglossal nerve controls both the intrinsic muscles and extrinsic muscles of the tongue, which are crucial for moving the bolus within the mouth. The trigeminal nerve also provides motor control of the muscles of mastication, which include the masseter, temporalis, medial, and lateral pterygoid. The oral transit stage takes the prepared bolus and moves it from the oral cavity to the pharynx to initiate swallowing. The vagus nerve, once the food is chewed, the bolus needs to be transported to the back of the mouth. The vagus nerve provides motor innervation of the palatoglossal muscles, which assist in elevating the posterior part of the tongue and lowering the soft palate. The hypoglossal nerve innervates the intrinsic and extrinsic muscles of the tongue, which are also crucial for bolus transport. The glossopharyngeal nerve plays a crucial role in the initiation of swallow by providing sensory input to trigger the swallow reflex and motor innervation to the stylopharyngeus and superior pharyngeal constrictor muscles to help elevate the back of the throat.
The pharyngeal phase takes place usually within a second and consists of propelling the bolus through the pharynx and upper esophageal sphincter into the esophagus and protecting the larynx and trachea from food entering the airway during a swallow. The cranial nerves involved in this stage are the glossopharyngeal, the vagus, the accessory, the trigeminal, the facial, and the hypoglossal. During this stage, the soft palate elevates and closes off the nasopharynx at the same time that the bolus is entering the pharynx. This elevation ensures that the bolus does not regurgitate into the nasal cavity. The epiglottis tilts backwards to seal off the larynx to ensure that aspiration does not take place. Cranial nerves 11, 5, 7 are responsible for sealing off the larynx, and the vagus nerve is responsible for the pharyngeal constrictor muscles, which sequentially contract downwards, squeezing the bolus through the pharyngeal cavity towards the upper esophageal sphincter. Once the bolus reaches the upper esophageal sphincter, the constrictor muscles relax with the help of the glossopharyngeal nerve, and the food then enters the esophagus.
There are 5 main muscles of the soft palate elevation, and the muscles are all innervated by the pharyngeal branch of the vagus nerve. The laryngeal elevation is a vital mechanism in protecting the airway during swallowing. And during this phase, the pharynx is moved out of the bolus, or moves the bolus, and the closure of the vestibule in order to complete the swallowing process. In the anterior hyoid excursion, the hyoid bone is moved upward, superiorly and forward anteriorly by the suprahyoid muscles. The contraction of these muscles, in turn, pulls on the larynx and the upper esophageal sphincter. Epiglottic inversion is a passive movement that helps protect the airway during swallowing. It involves the retraction of the tongue base and the elevation of the tongue. So the laryngeal vestibular closure is a complex mechanism that involves several muscles and structures working together to prevent material from entering the airway during swallowing. The pharyngeal stripping wave. The vagus nerve is responsible for the motor function of the pharyngeal constrictors, allowing them to move the bolus down the pharynx.
The glossopharyngeal nerve is involved in the elevation of the pharynx via the stylopharyngeus muscle. The vagus nerve is still responsible for the motor function of the pharyngeal constrictors, allowing them to move the bolus down the pharynx. The accessory nerve also helps with the contraction of the pharyngeal constrictors in the pharyngeal contraction phase. The pharyngoesophageal segment opening has two muscles, the inferior pharyngeal constrictor and the cricopharyngeal muscle. The vagus nerve and the accessory nerve are involved in the motor control of the pharyngoesophageal segment opening. They innervate the muscles of the pharynx and esophagus to initiate the opening of the pharyngoesophageal segment opening. Tongue base retraction. The muscles for this are the hyoglossus and the styloglossus. The hypoglossal nerve is responsible for tongue movement, and the glossopharyngeal nerve helps coordinate the tongue movement, as the vagus nerve and the accessory nerve help raise the back of the tongue.
The esophageal phase of swallowing is also known as the esophageal clearance, is the final phase in the swallowing process. It involves the movement of food or liquid from the esophagus into the stomach. First is the initiation phase. Once the food or liquid bolus enters the esophagus from the throat, the upper esophageal sphincter closes behind it to prevent backflow. Second, the paralysis state is the primary mechanism for esophageal clearance. This involves a series of coordinated wave-like muscles contractions that move the bolus down the esophagus. There are two types of paralysis. Primary paralysis. This wave begins automatically as soon as the bolus enters the esophagus. It is a continuation of the swallowing reflex that initiates in the throat. Secondary paralysis is the primary wave doesn't clear all the food. Triggered by the process or presence of the residual food or dissension of the esophagus to help move the remaining material down. Third, the gravity assistance subphase is how the gravity also aids in moving the bolus downward, especially when a person is upright. The fourth is the lower esophageal sphincter. As the bolus approaches the stomach, the LES relaxes and opens to allow the bolus to pass into the stomach. After the bolus passes, the LES contracts again to prevent the contents of the stomach from refluxing back into the esophagus. The last subphase is the muscular lining with mucus that lubricates the passages of the bolts, ensuring smooth movement. Additionally, saliva and esophageal secretions containing bicarbonate that can help neutralize any acid that might reflux from the stomach, protecting the esophageal lining. The stomach that LES relaxes and opens to allow the bolus to pass into the stomach. After the bolus passes, the LES contracts again to prevent the contents of the stomach from refluxing into the esophagus. The last and fifth stage is the muscular lining and secretions. The esophagus is lined with mucus that lubricates the passage of the bolus, ensuring smooth movement.
Now we're going to explain the swallow to an adult.
The 4 stages of swallow include the oral preparatory, oral transit, pharyngeal, and esophageal stage. The oral preparatory phase begins when food or liquid enters the mouth During this phase, the substance is chewed and mixed with saliva to prepare for the oral transit stage. In the oral transit stage, this takes the chewed food and pushes it to the back of the throat to initiate a swallow reflex.
The pharyngeal phase usually only takes about a second and consists of the chewed up food being propelled through your throat by muscles squeezing the food downward. Once the chewed up food travels through your throat, your muscles relax, allowing the food to enter your stomach, which is called the esophageal phase.
Esophageal clearance refers to the process by which the esophagus moves swallowed food, liquids, and saliva from the throat to the stomach. This process involves coordinated muscle contractions called paralysis and the actions of gravity. Efficient esophageal clearance is essential for proper digestion and to prevent complications such as difficulty swallowing, inflammation of the esophagus, and GERD.